2:30 public update. Today we're going to start with our medical update from IDPH Director Dr. Ngozi Ezike. But first I want to address why this live stream looks so different today. One member of my senior staff who was not exhibiting any symptoms has tested positive for COVID-19. And for that reason, in accordance with the best public health practices and protocols and recommendations of doctors, the rest of our team, myself included, is working from home for the time being. And I want to assure everyone that the governor's office is very much still in full operation, and all aspects of the executive branch will function as they have been. And with that, I'd like to turn it over to Dr. Ezike for today's medical update. Doctor.
Thank you, Governor. Good afternoon, and thank you for joining us on this new web-based platform. Let me start with a bit of exciting good news. We did receive our first allocation of remdesivir, the investigational antiviral drug. The National Institutes of Allergy and Infectious Disease recently conducted a clinical trial and found that patients who received remdesivir had a statistically significant shorter time to recovery compared to those receiving a placebo. The Department of Health and Human Services sent an initial shipment of remdesivir for the treatment of hospitalized COVID-19 patients. We received 140 cases of the medication this last Saturday, and the cases have been shipped to 14 hospitals around the state. Each case contains approximately enough vials to treat 5 or so patients, depending if the 5-day or the 10-day protocol is employed. Since it was going to be impossible for every hospital to get a case, we did establish a criteria, including hospitalization and intensive care unit data, and also trying to make sure that we had an equitable, transparent, data-driven way to allocate the medicine. It was distributed to hospitals that have seen the most critically ill COVID-19 patients. We also included safety net hospitals and hospitals treating large communities of color to address the equity aspect. We do expect to receive more remdesivir in the future, but our hope is that the allocation that we received on Saturday can already help to improve outcomes for some patients who need it most. Over the past 24 hours, I do need to report that 54 additional deaths were reported to bring our total COVID-19 death toll to 3,459. In the last 24 hours, 1,266 new cases have been reported for a total of 79,007 cases here in Illinois. We have been tracking cases at the Illinois Veterans Homes, including 40 current cases at the Manteno Veterans Home, 30 residents and 10 staff after testing of the entire facility, and 1 resident at the LaSalle County Veterans Home. Testing has already occurred at the LaSalle home, is currently taking place at Anna, and will occur on Tuesday at Quincy Veterans Home. Neither Anna nor Quincy are reporting cases at this time. The Illinois Department of Veterans Affairs is following guidance from state and local health officials, which includes continuing health screenings of staff and residents, maintaining social distancing practices, wearing face masks, using gloves, gowns when indicated, and intensified cleaning and disinfection protocols. As for hospitalizations across the state, 4,319 people in Illinois were reported to be hospitalized with COVID-19. And of those, 1,248 patients were in the ICU and 730 patients were on ventilators. To date, 442,425 tests have been performed, of which 12,441 were reported in the last 24 hours. We must continue to do all of the things that we've said here hundreds of times. Stay home as much as possible, wear a face covering, keep 6 feet of distance between you and others, and wash your hands frequently. These are the steps that will continue to help us stay healthy and get onto the other side of this pandemic. Thank you. And now I will recite our similar statement in Spanish. Buenas tardes y gracias por acompañarnos en esta nueva plataforma basada en la Internet. Quiero comenzar con algunas buenas noticias. Illinois recibió nuestra primera lote de Remdesivir, un medicamento antiviral. Recientemente, un estudio encontró que pacientes con COVID-19 que recibieron Remdesivir tuvieron un tiempo más corto de recuperación en comparación con los que recibieron un placebo. El Departamento de Salud y Servicios Humanos Federal envió un lote de Remdesivir para el tratamiento de pacientes en el hospital con COVID-19. 140 cajas del antiviral llegaron a Illinois el sábado y los casos han sido enviados a 14 hospitales en todo el estado. Cada caso contiene suficientes viales para tratar 5 pacientes. Sin duda, es imposible que cada hospital en Illinois obtenga una caja de Remdesivir y por eso distribuimos los antivirales en una manera equitativo, transparente y basado en datos. Remdesivir se distribuyó a hospitales que han atendido a los pacientes con COVID-19 más gravemente enfermos y hospitales que tratan las comunidades de color. Esperamos recibir más de esa medicina en el futuro, no sé exactamente cuándo, pero esperamos que el lote que recibimos el sábado pueda ayudar. Reportó 54 más vidas perdidas para un total de 3,459 muertes relacionadas a COVID-19. Desde ayer se han reportado 1,266 casos nuevos para un total de 79,007 casos en Illinois. Hemos estado siguiendo casos en casas de veteranos de Illinois que incluyen 40 casos en Mantino, 30 residentes y 13 empleados después de probar todos. También hay un residente que dio positivo en La Salle. Se están haciendo pruebas hoy en Anna y el martes en Quincy Veterans Home. Desde hoy no hay casos de COVID-19 en Anna o en Quincy. El Departamento de Veteranos en Illinois está siguiendo la guía de los oficiales de salud estatales y locales que incluyen evaluaciones de salud del personal y los residentes, el mantenimiento de prácticas de distanciamiento social, el uso de máscaras faciales, el uso de guantes y batas cuando se indica, y los protocolos intensivos de limpieza y desinfección. Informó que 4,319 personas en Illinois fueron hospitalizadas con COVID-19. De ellos, 1,248 estaban en la unidad de cuidados intensivos y 730 pacientes estaban en ventiladores. 12,441 pruebas hechas fueron reportadas en las últimas 24 horas. Estamos empezando a ver algunos signos positivos, pero todavía no estamos fuera de peligro. Debemos seguir haciendo todas las cosas que hemos dicho miles de veces: quedarse en casa cuando sea posible, cubrirse la cara, mantener una distancia de 6 pies entre usted y otras personas y lavarse las manos con frecuencia. Estos pasos son los que nos ayudarán a mantenernos saludables. Muchísimas gracias. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike. And we're now 11 days into phase 2 of our Restore Illinois plan. And I want to provide 2 updates, one on where each of our 4 regions stand on meeting the reopening metrics, and the other on the projections of our modeling cohort. As a reminder, the modeling that we follow is led by top researchers from the University of Illinois, Urbana-Champaign, Northwestern University School of Medicine, the University of Chicago, the Chicago and Illinois Departments of Public Health, and is managed by Civis Analytics. The modeling uses IDPH's data of daily COVID-19 cases, deaths, hospitalizations, ventilator and ICU usage, all of which is provided by every hospital in Illinois and by labs that are running COVID-19 testing. Since our last modeling update, the researchers have been able to plug approximately 2.5 more weeks of data into their models, and that's significant. As I told you in our last conversation on this topic, the essence of models is that they get smarter over time. The more days of data that you have, like how many COVID-19 patients were admitted to the hospital or how many cases were tested positive, the better their ability to project future outcome. Everyone tracking our state's data has likely seen that on a statewide basis, we haven't passed our peak yet. We have seen more stability in our numbers, but so far we are not seeing significant declines in key metrics like hospitalizations. The updates to our models reflect that data. Compared to the forecasts that I shared with you on April 23rd, which predicted peaking between late April and early May, that time frame of plateauing near a peak has been expanded from mid-May into mid-June. In many ways, this news is disheartening. We have made great progress, but it's forced us to remain at a moderated, though still high level of key metrics for this extended period. A pushing out of our estimated peak is a natural consequence of flattening the curve. Remember that no one can truly stop this virus without a vaccine. But what we've been aiming to do since early March is slow down the exponential rate of transmission. When we do that, it leads to a slower rate of infections over a longer period of time, giving our healthcare system the ability to treat those who have complications and giving our pharmaceutical researchers time to develop effective treatments and potentially a vaccine. Pushing the peak down and therefore to a longer time frame might not sound like good news to some, but I promise you, it is saving lives. A couple of other notes on our statewide projections. You'll recall that the Arnott value refers to how many other people on average will contract a disease from one person with that disease. An Arnott value above 1 means that each infection causes more than one new infection, and that means more transmission. The higher the number, the faster the infection is spreading. An Arnott value below 1 means that each existing infection causes less than one new infection. Over time, that will lead to a decline in new cases. An R-naught value of 1 means transmission are stable. When COVID-19 started, an estimate of our R-naught value was 3.6. That was before all the mitigations that we put in place, which nearly all of you have followed. Right now, I'm told our R-naught value for Illinois has fallen to 1.0, but not below 1. Once we get down to an R-naught value below 1, that will be very good news for all the people of Illinois. Our models also show that our hospital capacity and resources statewide are now sufficient to handle the current rates of transmission. That is, under our current phase 2 mitigations. There are those who advocate removing all restrictions now or at the end of this month, rather than taking the gradual course that our Restore Illinois plan does. If we were to lift all of our mitigations entirely at the end of the month, modeling shows that there would be a new surge of COVID-19 and a higher Arnott in each of the 4 regions, even in the least hard-hit regions of our state. Let me say this another way. Lifting all of our mitigations at the end of May would likely lead to a second wave of outbreak in each and every one of our 4 regions. That's why the Restore Illinois plan gradually loosens mitigations in each phase while introducing the face covering requirement, which is one of the best public health measures to keep the transmission rate low. To reach the next phase of recovery, we introduced health-centric reopening metrics, and I want to review how each of our 4 regions are faring since May 1st. Thus far, all of our regions are on pace to hit all of the metrics for moving forward after the 28-day period, with possibly one exception. In the Northeast region, the positivity rate as of midnight on May 8th is at 22.3%, which is, of course, higher than the 20% cap on this metric to move into the next phase. This positivity rate cap will be measured over a 14-day period, so there's time for the Northeast region to fall below this cap. As for what positivity looks like in the other regions, the North Central region is sitting at 9.1%, the Central region at 6.0%, and the Southern region at 10.5%. Because hospitals vary in the time they take to submit and verify data and diagnoses, the data that I share here and the data you can see on our website reflects our hospital landscape as of midnight on Friday, May 8th. To date, all the regions have seen a dip in hospitalizations since May 1st. An 18.6% decrease in the Northeast region, a 35.8% decrease in the North Central region, and 44.4% decrease in the Central region, and a 54.3% decrease in the Southern region. Remember, the requirement here is that a region sees no overall increase in hospital admissions for COVID-like illness across a 28-day period. So far, every region is on track to meet this metric. And for the third requirement of available surge capacity of at least 14% for each of the medical surgical beds, ICU beds, and ventilators, in the Northeast, med-surg bed availability was 17.8%. ICU bed availability was 18.8%, and ventilator ability was 64.3%. So far, all hospital metrics are being met in the Northeast region. In the North Central region, med-surg bed availability was 41.1%. ICU bed availability was 40.6%, and ventilator availability was 64.9%. All hospital metrics are being met in the North Central region. In the Central region, 52.4% of med-surg bed are available, 44.2% ICU bed availability, and 74.6% ventilator availability. So all hospital metrics are being met in the Central region. And in the Southern region, 45.8% med-surg, 28% ICU bed availability, and 80.7% ventilator availability. All hospital metrics are being met in the Southern region. Over these next 18 days, I'll share updates on this information with you regularly, at least once a week, with likely more updates as we get later in the month. Until then, I'm happy to take questions from the press today, and bear with us as we work to do this over video streaming for the first time with Dr. Ezike in one location and me in another. Thanks, and happy to take the first question.
We will go to Marianne Ahern, who is our pool reporter from NBC5 first. Good afternoon. Thank you very much. First of all, can we talk about your senior staff, or could you give us some more information? How long have you known that the person tested positive? How long do you expect to be working from home?
Well, we're going to follow the doctor's orders. We discovered the person who tested positive late in the week. In fact, I think that we were notified on Saturday that occurred. So the test had been done a few days earlier in the week. So that was when we discovered, and it's slightly different lengths of time for people depending upon their contact with the person, how recent that contact was, et cetera.
And do you plan to identify who the person is for those of us who might have been in the Thompson Center who wonder as well, should we be tested?
No, we don't want to reveal the name of the person who had tested positive. That would be a breach of their privacy. However, they have given us all of their contacts, all of the locations they were in. They were not in the Blue Room at any time for any of the press conferences. And so there's no reason that you or any of the press would have been exposed to that person.
How close in contact are you to that person?
Well, they work on the same floor, down the hall. I don't know how many feet, but quite a number of feet down the hall from me. I don't have regular, everyday contact with that person directly, although that person would every day sit in a large meeting room where we were all socially distancing. And so, out of an abundance of caution, I think we all felt that because that person is there every day and interacts with, other members of the staff on a regular basis and me on a slightly irregular basis, that we wanted to make sure that we followed all the rules for socially distancing and in particular for isolating.
This person works in a public job. It is different than working in a private company. The White House has released the names of the two people who have tested positive there. Would you not want to be as transparent as the White House?
Well, this is not a public person. And again, this person, we've identified all this person's contacts, and just like the contact tracing protocols call for, there's no release of the name of the person who was found to have COVID-19, but all of their contacts are notified that that person had COVID-19 and what the options are for self-isolating, getting testing, et cetera.
And how is that person feeling?
Thank you. I was in contact with that person today. That person is still asymptomatic, and so feeling fine, although obviously it's a anxious ridden moment for that person just to know that they've tested positive.
Some are asking, where are you right now? Are you in Chicago?
I am in Chicago. I have been in Chicago for for quite a while, some days, and I'm at my home.
Thank you. Tony Arnold is asking, even though you are feeling healthy, does this incident make you consider about putting a succession plan in order should you come down with COVID-19 and the Lieutenant Governor needs to step in?
Well, the succession plan is in fact in the Constitution. And as you know, we have a terrific Lieutenant Governor, highly capable person who, if she needed to step in, would of course be terrific at managing everything. But I feel fine and I have tested negative, and so I don't think, at least at the moment, that there's any real danger.
Governor, today the still persistent questions about the unemployment. And I know those filing and those who are freelancers and contract workers finally are able to get online. And I would be remiss if I didn't name all of the reporters who have asked me a question. At least 5 have asked me to ask you. There are still problems. Freelancers are not impressed at all with adding staff. It's asking for driver's license. Some people, their driver's license has expired during this time. There are persistent problems even today.
Well, let's start with there have been 44,000 successful connections online for people who wanted to file today. And, those people have been able to connect their applications. Many of them have been submitted. The challenges that exist for people who have an expired license. I can't speak to the expiration of their license, except that the Secretary of State has extended the expirations of licenses for everybody whose license expired during this time period. So they shouldn't worry about that. I think the bigger challenge is that we had some glitches, again, with phone calls today. The entire phone system for the state of Illinois actually had some interruption today. And so that went down. I believe it's back up again. But other than that, on the first day of launch of this new system, the number of people who've been able to successfully file, my understanding has been quite large.
Today, from the minority leader Durkin as well as Bill Brady, they've sent a letter, and they're saying and they're asking again to reconsider your extension. They feel the 28 days is just too long, and would you possibly consider a 14-day measurement instead?
I think the day that we announced it, just to give you some perspective, the day that we announced the protocols, for Restore Illinois, the metrics, was actually the 6th of May, I believe. So we were already 6 days into the 28 days. So there were, I think, 22 days left. If I'm wrong, I'm off by 1 day. But so the difference between, 22 days and 14 days, we can have a discussion about, certainly, but the effort here is the same. I think we all have the same goal, which is to get people back to work, but to do it safely. And remember that the 14-day guidance that was put out by the White House is actually more stringent than the guidance that we put out. Their guidance would have required 14 days of a decline in the numbers. And what we require is simply following a flattened number for 28 days, which is a much easier metric considering everything I've just told you in today's update.
At the same time, Governor, places like even New York, and New York is ground zero. The governor of New York today is going to start reopening on Friday. Massachusetts is going to start reopening on Monday. And yet we don't hear in Illinois a date, which has so many so anxious, whether or not that date is June 1 for some movement or not. Are you able to consider tweaking your plan?
I think the earliest date would be the 29th of May. So rather than in June, but the 29th of May. And we're not looking so much at the tweaking of the plan. I think what we remember that we did, in fact, open things up on May 1st. We brought back retail, again, curbside and delivery retail, as well as making sure that we opened our state parks, we've opened now our elective surgeries. So all of those things, which you're now identifying, those are things that are in other states' plans that are just beginning now. We actually did about 10 days ago.
A question for Dr. Ezike from Michelle Gallardo from WLS, ABC7. We have received reports from people who witnessed long lines and large crowds inside and outside of restaurants over the weekend. The people in these crowds were not social distancing or wearing masks. How do we safely reopen when situations like this take place? And what message would you share with people engaging in that behavior?
Marianne, thank you for that question. So that's deeply concerning and troubling. When I hear of reports such as that, I shudder, because I feel like you can imagine that cases of coronavirus were potentially spread in that arena, which potentially could mean a week or so later, there could be some associated hospitalizations from that. So with that in mind, I just encourage everyone, there have been, allowances that have been made. We just want people to be as safe as possible. And if you cannot keep 6-foot distance, please try to use some kind of face covering to protect yourself, to protect others. We really, I mean, the goal should be the same for everyone. We just want to limit the spread of infection, and remembering that you might not have symptoms to make it very obvious that you have anything that potentially could be spread. So keeping that in mind, if everyone could just use the utmost caution, still stay at home as much as possible, but when you have to go out, please at least observe the social distancing and use the face covering. Those 2 steps, which I don't think are that hard, can make a giant bit of difference on the back end when you think of potentially hospitalizations averted and lost lives averted.
Governor, from Amy Jacobson, WIND Radio. Gov, we are glad you are taking the proper precautions. Is anyone else in your family under a self-quarantine?
We are, following all the doctor's orders here at home. So, we have been really self-isolating, in my home anyway, for some time now. So that's, we're trying to follow all the best protocols and to keep each other safe.
All right, from Mike at Quincy Media, a Quincy bar and grill reopened this morning, and other businesses say they plan to also do so by the end of the week. Quincy and Adams County officials, including law enforcement, have stated they don't plan to enforce your stay-at-home order. But how are you going to allow these businesses to operate?
Well, again, as I've said all along, people who open their businesses at this time, knowing that the mitigations are just now beginning to help us bend the curve down. We flattened it, but the goal here is to bend the curve down. Ultimately, that by opening early, they're putting people at risk. And the potential here is that we'll have an upsurge in Quincy of cases and hospitalizations, and that will drive that whole region potentially to a point where it may not reopen. So I think they're putting people at risk, and they're putting the entire region's economy at risk by opening early.
And so, Elizabeth Matthews, similar question from Fox 32. What about restaurants that have been have you been in discussions at all about perhaps opening before phase 4?
Well, certainly we've talked to staff people. Our staff people, rather, have talked to leaders in the restaurant industry. I have been in contact with people in the restaurant industry. And, our goal, again, is to try to open everything in a reasonable amount of time as fast as possible while keeping people safe. And they've suggested in the restaurant industry, leaders like Sam Toya, ways in which they want to do that. But it's true that it is difficult to open restaurants and bars in a circumstance in which we need to, in phase 3, make sure that there aren't groups of 10 or more than 10 gathering, and making sure that we're limiting the transmission that can occur with the service of food and drinks. So
you may consider it? You might consider before phase 4? Is that what I'm hearing, or no?
No, I mean, we put our plan out there. Look, let me rephrase that. Anything can change along the way here. The biggest thing can change is if we get a treatment. That's the thing that will change the game. And I've said all along that we'll alter the playbook, if we need to. But the fact is that we put a plan out there. Really, nothing has changed since we put the plan out there. So, the intention here is to stick with the plan. But it is true that I'm talking to people in various industries and listening to their ideas, most especially for when things open, how to do that most safely.
A question from one of my colleagues here, Kate Chappell. Sale of premixed cocktails. They had been going on. Now they've been asked not to do it. 20 state lawmakers have joined the cause to say, please let these restaurants that are doing the takeout orders continue to do the cocktails. Also, there's been a petition of 1,100 who have signed. However, the state is saying they are sending out cease and desist orders on that. Where do you stand on the premixed cocktails being sold with the carry-out food?
Well, it's something that, again, we listen to the epidemiologists and the experts about, about whether or not the delivery of mixed drinks, if are they closed, are they package like, because, that's something that matters in the process. But look, it's something that no doubt that our team and IDPH is looking at and will look at.
But Governor, so yes or no is kind of what folks are looking for.
But I'm not making any changes to the plan that we've put out, to be clear. But I certainly want to hear from everybody about why that ought to be in the next phase, because that's when things will change.
Okay, from Eric Rung from WGN TV, nursing homes continue to be hot zones in the virus. Meadowbrook Manor in Bolingbrook recently saw a spike, bringing its death total to 26 and is now on one of the highest death tolls in the state. What, if anything, is IDPH doing to help contain the virus there? Does the staff have the training and the tools to protect themselves and others at this facility?
Well, the staff at every one of the nursing homes that has had an outbreak receives a plethora of not only training, but actual equipment, PPE, to make sure that they're able to keep themselves safe, and then protocols to make sure that they're separating people at these homes as best they can, so that we can, keep COVID positive patients or residents, in a separate and contained from those who are COVID negative. These are extraordinarily difficult circumstances. You've seen this all over the country, and we've really been in touch with so many different states, as well as with the CDC, to make sure that we're following the best protocols that are available. And, certainly Dr. Ezike ought to weigh in here, but I can just tell you that this is one of the most vexing problems with this virus. It's insidious, the way that it can get into these homes and the way that it spreads, even with all of the infection controls that we can put on top of it. It's just extraordinarily difficult. But Dr. Ezike, maybe you have something to add.
Yeah, just to echo what the governor is saying, of course, it's not a consolation, but it's a problem that the entire country is facing. We were on a White House call earlier today where states were saying that, over 50% of their fatalities are in this population. So, of course, every long-term care facility already has an existing infection control protocol. And so we are trying to assist with making sure that those are properly followed and maintained. Of course, that we have been very active in pushing out PPE to make sure that the appropriate protocols can be followed involving the use of PPE. We are really, working with our infectious disease consultants that we have at the major universities throughout the state. We have people that go in person. We have people that consult by phone. So we're really working hard to do all that we can, and we stay on this. It is a very challenging environment. We said that even before we had our first case, and it's proving to be very true, but we're staying on it and trying to see what we can do to dampen the spikes that we're seeing. Of course, that we proactively went on in and were testing staff and residents in nursing homes that didn't even have a case. And actually, we heard just recently on the White House call this morning that they are asking that everyone tests in all nursing homes over the next 2 weeks. Again, something we've already been doing for many weeks. So I think we are doing the right thing as we see other places and the federal government trying to do some of the things that we have already enacted. It is definitely a challenging problem, but we stay on it.
On that vein, from
Mary Ann, this will have to be your last one because then we'll switch to another pool reporter.
I've got like 3 more, just real quick. They'll be fast, I promise. But please don't cut me off yet, because I don't want folks mad at me that didn't get to ask their questions. One other one. If asymptomatic people spreading COVID-19 is a concern, this is from Greg Bishop, is IDOC performing these tests on inmates being released from prison? If not, why not?
Well, IDOC is performing tests on staff on a regular basis, and anybody that's got any symptoms. And then as people are being released, they go through a process over a number of days before they actually are released. And so again, they would likely show symptoms during the course of that process. It's known who's being released for days, in fact, weeks before they are released. So, there's not a need to go test every single one of them.
Okay, what about contact tracing? What are the city requirements? This is from Univision. Would you need any of these college certifications that are popping up? And how do folks apply to be contact tracers?
People will be trained for free as part of the contact tracing program that we're going to be, that we're spinning up. And so it is not necessary for people to pay for a program if they get hired as a contact tracer. You get hired not based upon having a credential as a contact tracer, though we will be hiring healthcare workers. There are people who are community healthcare workers who have some of the training that's already required. And so those folks will be among the first that get brought in, along with the many people who are already doing contact tracing all over the state. Our goal here is to weave together the county health department's contact tracing, which occurs, all across the 102 counties to varying degrees. We want to make sure all those people are part of this larger process while we're also going to be hiring new people to join.
Thank you. Dr. Ezike from Craig Wall, can you describe your faith influences day in and day out during especially this difficult time? Can you talk a little bit more about the Mother's Day sermon that you delivered at your church?
Okay. Well, I was honored to be given the opportunity to share a Mother's Day message. Each year, a mother is selected to give the Mother's Day message, and I was able to talk about my faith and the influences in my life and how having an extra source of strength has really helped me get through this difficult pandemic period.
And could you give us any more? I mean, is that something that was difficult for you to express, or I would think it comes from the heart? I don't know.
No, I'm not shy about the fact that I am nothing without having my my source of strength and my guide, which is my God. And so being able to share that with my community is something that I think is an important thing to do.
Thank you. And now I feel rather foolish asking this next question on such a more important note, but I have been giving this question from several people. Governor, have you gotten a haircut? I know it seems like silly, but so many folks would like to go get a haircut themselves, and they've noticed that you appear to have gotten a haircut. Who did the haircut? Where did you go to get it?
No, I have a pair of clippers that I use that I've been using on the sides of my head. I asked my 15-year-old to give a little buzz on the back of my hair, and that's it. I haven't had a haircut other than that, and but I'm glad that people think that it looks like I had a haircut.
All right, I apologize ahead of time on that one, but thank you very much for your time.
Thank you.
Kelly, you're up.
Governor, this is Kelly Bauer from Black Club Chicago.
Hi, Kelly.
First, multiple churches in Chicago held crowded services over the weekend. What would you say to parishioners and pastors who are gathering for services despite the stay-at-home order?
That you're likely not only breaking the law, and the mayor has made it clear that those services are not allowed, but also you're potentially putting hundreds of people in danger. And that's something that I think people should be thinking about, the parishioners and the faith leaders who are conducting those services, that it's not just about yourself, it's about all the many people who will attend, and even more importantly, the many people who will be come in contact with the people who attended those services. Because we just talked about asymptomatic COVID-19. And so it's highly likely, in fact, that when large groups of people are getting together right now, given that there isn't enough testing to manage across the country, to manage, large crowds, to know that people that you're with don't have COVID-19, that, there are going to be carriers among the crowds of people who are getting together. So I just warn people that while they're, carrying out their faith and the things that they believe in most, which I hope include caring for your fellow human beings, that they'll take into account that caring for your fellow human beings means keeping them safe.
All right. And then another from Black Cup. Illinois hairstylists and barbers have been struggling without unemployment for weeks, and now stylists are going back to work in nearby states like Indiana. Is there any way Illinois could provide relief for stylists or allow them to safely reopen sooner here?
Well, as of today, those independent contractors, small sole proprietors can apply for unemployment under the CARES Act and through the portal that's been provided at the Illinois Department of Employment Security. And of course, in phase 3, which, as I spoke about, many of the regions are headed toward moving into phase 3, barbers and salons will be able to open back up again.
All right. And then from Tina Spondalis from the Sun-Times. The Sun-Times reported Sunday that recent nursing home deaths in Cook County are concentrated in the poorest rated facilities. Do you have any plans to move residents out of those places? How about putting them in underused field hospitals like the one the Cook County commissioner suggested?
Well, I think I'd like to turn it over to Dr. Ezike from the Department of Public Health, which oversees nursing homes, but I'll just begin by saying that those alternate care facilities are really intended to be for transfers from hospitals of people who are less acute cases. And so that was really what the purpose of those alternate care facilities was and is, and it's the best use of those. But Dr. Ezike?
Yeah, so of course our methods remain the same in the situation. We want to reinforce the appropriate guidelines, enforce the appropriate infection control measures, make sure that the staff requirements for testing, pre-shift assessments, that those are consistent. Please remember that when you're dealing with this fragile elderly population, maybe many with maybe dementia or memory care issues, repositioning them to an entirely different place is very unsettling and destabilizing, and actually could potentially do more harm than good. So ideally, we'd like to keep people in the home that they know, that they're comfortable with, and be able to strengthen any deficiencies that are identified so that that place can provide the appropriate care in the appropriate manner with the appropriate PPE and the appropriate staffing.
Thank you. And from Hannah Meisel from the Daily Line for Governor Pritzker. Is it time to revisit the Restore Illinois plan and tweak it to include the regional concerns of the IML? Are you open to those ideas? Or are you prepared to stick by your plan and bear the whole responsibility, or whether it succeeds or fails without sharing it with the legislature?
Let's go from the Illinois Municipal League. And I understand that they would like to break the state into 11 regions and not just 4 regions. And I know there are other people who would like to break the state into every county, 102 counties, and yet others who would like to do it by city or by town. And I'll just say that there are lots of ways that it could be done. But there needs to be a uniformity to the way that we manage the state of Illinois. We've broken the state up into 4 regions, allowing each one of them with the same set of metrics to perhaps be faster to move into another phase than another. And so that's why we put the plan forward as it is. As I say, as circumstances change, as we find, for example, that there are fewer COVID-19 symptoms that are affecting people because there might be a treatment that's available, we will of course revisit Restore Illinois. The goal here is to, as I say, reopen the state as fast as possible, but in a safe fashion, that saves as many lives as possible.
All right. And then for Dr. Ezike, why has it taken Illinois' Arnott value so long to fall when other large states saw it fall below 1 faster? If Germany faltered on reopening when its Arnott value was 0.7, how can Illinois be sure the number won't just rise again this summer?
We can't be sure that it won't rise again this summer. And that is obviously the concern. And that's why we want to slowly and cautiously be able to follow the data and move through these stages to be able to properly assess how the changes that we make at each stage actually affect obviously the mobility of our residents, which obviously affects the effective R. If people have been strictly at home and then now they're out and about a little bit, obviously the effective R, or the R naught that you're referring to, is not going to be the same. And so being able to watch the effects of each of our changes is an important part of the evaluation as we move through these stages, so that hopefully we can catch before we get too far in the wrong direction if some of the loosening has been too fast and has resulted in, strong spikes or peaks that we don't want to see.
For Jamie Monks from the Chicago Tribune for the governor, how many times have you been tested for COVID-19? And with the governor's office self-isolating and working from home, how does that arrangement affect the administration's ability to manage the current situation?
Well, let me start with the fact that many of our staff people already were working from home. We tried to make sure that we did enough social distancing by allowing those, particularly those who were most vulnerable, to continue to do their jobs from home. The Illinois, our Department of Innovation Technology did a terrific job of creating the opportunity for so many state employees to work from home. And so we took advantage of that by allowing much of our staff to work from home. And they've been doing a terrific job. They're on the calls every day. They're in touch with us, all day long, working on projects throughout the day and getting things done. So the functions of the governor's office have really been operating well, even with a smaller group of people working in the Thompson Center or or in Springfield. But now that we've moved the remaining 20 or so plus people out of the office for isolation, we've been in contact all day today, making sure that we're, following all of the things that we need to follow each day and getting things done. We've got to make sure that we're moving swabs to all the right locations across the state. We've got to make sure that we're continuing to build up our capability to do testing. The contact tracing effort is also spinning up. We have a number of things that are really swirling about, and we're all doing those, again, all day today. We've been working on it, and even yesterday, that was the case. And as to me, I was tested earlier in the week, last week, when others in our office, when the whole office was tested, those who are working in the office, that is. And then when there was the discovery of the one person, there was a desire to have me tested again, just in the wake of that, since enough days had gone by of interaction with that person. And so I was tested again yesterday. I think that I actually did the swab early in the morning. The test came back, 24 hours later, I believe. And it tested negative.
All right. This one from Greg Hines with Crane. There are growing signs that legislators want to see action on a bill to somehow delay or give a break to people on paying their property taxes this year, perhaps waiving fees and interest. Does the governor still consider that a strictly local matter, given that the deferred income taxes by 3 months?
Well, we certainly need to consider everything that we can to alleviate the burden on people across the state. So anything that we can do is worth considering. Obviously, there are pros and cons to each one of these things. When you decide, for example, to not collect property taxes, you're affecting local governments and their ability to deliver services. But of course, I know that there are people that are struggling perhaps to pay their property taxes. So, I think all that should be considered by the legislature, and I'm hopeful that the legislature will be in session soon so that they can consider that. And it's something that I would consider too.
Also from Greg Hines with Cranes, do you believe the legislature must assemble in some form before July 1st to pass a budget, or are you prepared to go without one like Bruce Rauner?
Well, I think I'm nothing like Bruce Rauner and don't believe much in what he was doing. But I do believe that the legislature should get together and convene, so that a budget can be passed. There are a number of other vital things. It's a short list of things that are absolutely necessary. But from my perspective, a budget is one of those things.
From Cassie Walker-Burke of Chalkbeat, the State Board of Education last week said districts should develop plans for virtual summer school and that summer school won't occur in person. Chicago notified parents Friday. Is the state planning on expanding funding available for summer schools, or should districts plan to use their Emergency CARES Act funds? Have you determined how you plan to use the emergency funding that governors are receiving directly for schools? And if so, is summer school on the table?
Certainly a lot is being invested through the CARES Act directly with schools for e-learning and other summer programs, but the same thing is also true through the governor's office. That is to say, the CARES Act provides for the governor's office to do so. And we are focusing much of that on e-learning and also on making sure that we're dealing with the kind of potential of the loss of learning over the summer. So those are all things that we're considering. And as you look at the Restore Illinois plan, obviously in a phase 3, when still we can't have gatherings of more than 10 people, it would be very difficult to have in-person summer school, though possible in very small groups, but not likely in many places. So it would have to really be in phase 4. And that also could occur in the middle of the summer.
And then our final question from Mark Conkle. Why haven't you released a testing strategy that hospital CEOs are clamoring for and led Chicago to launch its own testing?
I'm sorry, can you read that question again?
Yes. From Mark Conkle. Why haven't you released a testing strategy that hospital CEOs are clamoring for and that led Chicago to launch its own testing?
Actually, we have a testing strategy, and we have been working with hospitals all across the state on that testing strategy. Much of it is, focused around making sure that we're using the available equipment at hospitals and that we're focusing the collection of specimens in the places where we're going to be testing those who are most vulnerable, as well as doing our surveillance testing across the state. So we have been following a testing strategy, and we'll continue to do that. And I think there was a last part of that question I want to be mindful of.
He had asked that led Chicago to launch its own testing.
Yeah, actually, we've we encourage local governments to launch testing as best they can. The state has really been in, the best position, I guess, would have been the federal government had they taken it up, but the state's been in the best position to gather the supplies and to identify the locations of the machines, and then to make arrangements and partnerships with those institutions that have these many of the multi-million-dollar machines. And so, but we absolutely encourage the city of Chicago, city of Aurora, the cities all over the state, counties, and others to launch testing wherever they can. The more testing, the better. There's no doubt about it. We've been leading our own testing effort using not just the state labs, but as I say, working with hospitals that already have the equipment and commercial laboratories that will give us results in a timely fashion. That's very important to us. And so, we have been, in fact, very widespread, and effective, I think, strategy so far of ramping up testing and focusing it on those communities that need it most. Again, I would remind you that we've come from kind of, a world where very few states were doing very few tests, or I should say all the states were doing very few tests. We now are the second largest testing among the top 10 most populous states in the United States, and we continue to grow our testing ability and are hoping that we can, we're going to fight to be the biggest and best testing state in the nation. And certainly on a per capita basis, we're almost there.
Okay, Governor, we'll go to some of our online questions. Amanda Vinicky at WTTW would like you to comment on the breaking news that the Illinois Supreme Court will not take up the AG's request to weigh in on your authority regarding successive orders during emergencies.
Yeah, it's an unusual circumstance that the Supreme Court would, in fact, take a case directly from circuit court and not let it go through the normal process. But I think it was the right thing to do for the AG to seek the Supreme Court's intervention. But the Supreme Court is not saying they're not going to rule on this ever. They're just saying that they don't want to skip over the appellate court, is my understanding.
Jim Haggerty at Rock River Times. Governor, there is now a widening push for more testing at nursing homes. Will more testing and stronger mitigation of congregate settings help prevent more COVID-related deaths?
I hope so. We are doing much more testing. As you know, we've been ramping up testing at our nursing homes for some time now as more tests are available. And so we'll continue to do that. Again, the strategy is to try to keep those nursing homes that don't have any COVID cases in that condition, and in the places where there already have been people who've tested positive, to do all the mitigation efforts that we can to make sure that we're doing testing among the staff and also treating it as if every resident at every one of those COVID positive facilities, we're going to treat them as if they have COVID-19. That is to make sure that we're isolating, distancing, and and giving them every consideration as if they were a patient with COVID-19.
Andrew Davis at Windy City Times. Illinois has COVID-19 data based on age, race, and ethnicity, but there is no sorted data on basis of sexual orientation or gender identity. Is that something you're considering?
It's not something that's being asked on the forms that people are submitting. The hospitals are submitting. And so I don't currently see that there is going to be a collection of that data. But perhaps I should turn it over to Dr. Ezike if she has anything to add.
Yeah, it's not collected on any information on any forms that currently exist. It's something that we can put towards our advisory committee to see if that's something we should be looking into. But again, there are no forms that request that information.
Shia Kapos at Politico. Congress could consider CARES 2 as early as Friday. It would benefit smaller towns that missed out on the first relief package. Will Illinois follow through with additional funding for these towns as well?
Yeah, the goal here is that there will be a package that will support smaller cities than the one that the last CARES Act did, as well as the states with funding that doesn't have the restrictions that the last set of funding did. So it absolutely is the case that by funding states, particularly our state where we have LGDF funding for local governments, that there will be a good deal of money that comes from the federal government that will also flow to small cities, towns, and counties.
A few people had a question about remdesivir and how it was distributed. Amanda has the best worded one, so I'll read hers. In deciding how to allocate the remdesivir, why did no Collier County hospitals receive the drug, including hard-hit areas like Waukegan, Joliet, and Elgin? Please explain more on the detail and the criteria you used. Dr. Ezike is probably the best person to answer that.
So we did try to do a rank order of hospitals who had participated, obviously, in COVID care that had the largest number of hospitalizations, ICU admissions. But we also had to try to make sure that it was distributed throughout the state, as I mentioned earlier, that all restore areas got some drug, and we also wanted to make sure that we had included some safety nets, and we also wanted to include some hospitals that concentrated had care for communities of color. So using all of those and knowing that there are over 200 hospitals and we only had 140 cases, and we weren't going to open up the cases and start breaking up to give individual vials for people, we had quite a few limitations and came up with really the most equitable data-driven strategy that we could. Again, we're hoping to get more, and we will definitely take into account people who received previously when we get the new shipments. And again, I don't have any information on when those future shipments are coming in.
Rich Miller from Capital Facts. Governor, you said on CNN yesterday, quote, "We think that we can have a massive contact tracing program up in the next few weeks." How is that possible?
Yeah, I mean, perhaps I didn't word it quite correctly. What I was trying to say was we are spinning up a massive contact tracing effort across the state, and over the next few weeks, that will be launched, and it will be a large effort that it is going to take us, some time to hire up and make sure that we've got the breadth that we need and all the people that we need. But I also want to say that backing up that a large contact tracing effort that we're trying to get up and running here is the existing contact tracing effort that we've got really across almost every county in the state. And so we're plugging in the existing capability as well as many of the community healthcare workers. Chicago has hundreds of those already and has suggested that they will be bringing those people into this new larger contact tracing effort. So, I have confidence that we will have, grown this significantly. But yes, it's true that it's over more than just a few weeks. It will take in order for this to become massive, but it is a plan. When you're talking about having over 3,000 people do contact tracing, and we're starting with, no central organization, to do that from. When you start with a plan and a leader, and know which direction you're going, we're going to go as fast as we can.
We'll get to a couple more quickly here. Ben Cox at WLDS. Representative Darren LaHood has recommended the Adams County plan for reopening in downstate and non-collar counties in the state. Have you looked at that plan, and do you agree with it?
I have looked at that plan. Indeed, I spoke with the mayor of Quincy about that plan, and I read that plan. It's got a lot of really good points in it, some of which I have considered in the process of putting together the Restore Illinois plan. So, there's a lot of overlap. I think the biggest differences, frankly, are in timing. There are people who want to open everything up sooner, much sooner. And I talked a little bit earlier in my remarks about the fact that if we did that, we would really have a surge of cases, and it is, could potentially lead to an overwhelming of our hospitals and many more people getting sick. But, we have a good plan out there. It is a regional plan, and it takes into account that Adams County is very different than Cook County, for example.
Sam from NPR Illinois will be our last question for today. Will you, Governor, place a moratorium against creditors that are affecting credit scores negatively and threatening judgment against Illinoisans who are already faced with challenges to sustain their livelihoods during this pandemic?
It's an excellent question, and I had conversations this morning with an economist about some of the things that we need to be thinking about given the severity of this financial downturn and its impact on families and individuals and small businesses too, and how we might mitigate those, allowing people to restructure and not have it affect them on a permanent basis the way that sometimes bad credit rating can affect somebody. So it is something that's part of a broader effort that I'm talking to experienced economists about.
Okay, thank you everyone for joining our daily update today. We will see you tomorrow.